This is Health Broadcasting Service HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
HBS Radio is who you're looking for.
The topic on today's discussion of Your Health, a program brought to you by the Health Broadcasting Service HBS radio channel, is albinism. What is albinism? And how does it occur? Does it run in families? These are some of the questions we will briefly examine together in today's segment. Please sit yourself comfortably and let us begin to learn. Albinism is a rare group of genetic disorders that can be inherited from family line. It is a condition affecting the production of what is known as melanin in the human skin. Melanin is the pigment responsible for providing the colors to our skin, our hair and our eyes. Albinism is a lifelong condition, but it does not get worse. People with albinism have reduced amount of melanin, or they may not even have at all, and this can affect their skin color and their eyesight. Albinism sufferers, popularly referred to as albinos, often have white or very light blonde hair, even though in some parts of the world they may also have brown or ginger hair, most especially in the tropical regions. The exact color depends on how much melanin the body produces. This could vary from one person to another. In another vein, albinos, because of their very pale skin, tend to burn very easily under the sun, and do not usually tan, and so for sufferers of albinism the hot sun in some tropical countries pose a major problem, because they usually would have to wear hats, or go around with umbrellas, or altogether avoid going out under the sun. The reduction of melanin in the skin of sufferers can also cause eye problems for albinos. This is because melanin is involved in the development of the retina. Retina is the thin layer of cells at the back of the eye. At this point, let us begin to answer some of our questions we posed earlier on. How is albinism diagnosed? Albinism is detectable from a baby's appearance at birth. A baby's hair, skin and eyes may be examined by the health professionals to check for signs of missing pigment. Albinism can cause several eye problems. The newborn may have to be referred to an eye specialist known as an ophthalmologist for further tests. Electrodiagnostic testing could also sometimes be used to help diagnose albinism. This is where small electrodes are stuck to the scalp of the baby to test the connections of the eyes to the part of the brain that controls vision. Is albinism passed on? Simply put, albinism can be passed on through genes. If two people with the same type of albinism reproduce, all their children will have albinism. If two people with two different types of albinism have children, none of their children will have albinism. From the point of view of medical science, there are two main types of albinism. Occultaneous albinism, generally referred to as OCA, is the most common type, affecting the skin, hair and eyes. Ocular albinism, referred to as OA, is a rarer type that affects mainly the eyes. In both types, albinism can get passed down the family lines. We will be looking at this more in depth in some future episodes. Meanwhile, it is possible to tell if a newborn has albinism by merely observing his or her appearance after birth. A baby's hair, skin and eyes may be examined to check for signs of missing pigment. As albinism can cause several eye problems, it is normal practice to have an albino baby referred to the eye doctor, known as ophthalmologist, who may prescribe treatments, such as glasses or contact lenses, that can improve his or her vision. A child with albinism may also need extra help and support at school. Parents should not hesitate to ask for and ensure that the child is provided with extra support when it is required, both within the family and at school. Often, as an albino child gets older, they would need regular eye health checks, and it is also probable they will be required to wear glasses or contact lenses to correct vision problems. Vision aids would include large print or high contrast books and printed materials. Magnifying lenses, a small telescope, or telescopic lenses that attach to glasses to read writing in the distance, such as on a school whiteboard, large computer screens, software that can turn speech into typing or vice versa, tablets and phones that allow you to magnify the display to make writing and images easier to see. Living with low vision, unfortunately, is usually part of the story, an albinism sufferer story. Therefore, eye-photophobia, also known as sensitivities to light, could mean that a sufferer would wear some tinted glasses. Wearing some wide-brimmed hat outside can equally help with sensitivity to light and prevent sunburn. There is currently no cure for nystagmus, a condition where the eyes move from side to side involuntarily. It is not painful and neither does it get worse. Certain toys or games may help a child make the most of the vision they have. An ophthalmologist will be able to provide further advice in this regard. Surgery, involving dividing and then reattaching some of the eye muscles, may sometimes be an option. Squint and lazy eye. A squint or lazy eye are part of the frustration of an albino. The main treatments for squints are glasses, eye exercises, surgery, and injections into the eye muscles. If an albino child has developed a lazy eye, the conventional treatment, and which they may benefit from, is wearing a patch over their good eye to encourage their other eye to work harder. Skin care. Let's briefly talk about exposure to direct sunlight and the risk factor. It is important that sufferers of albinism are protected from prolonged exposure to direct sunlight, because they lack melanin in their skin and are certainly at an increased risk of getting sunburn and skin cancer. Wearing sunscreen with a high sun protection factor, SPF of 30 or more, will provide the best protection. Always look out for skin changes, such as a new mole, a growth or lump. Any moles, freckles or patches of skin that change in size, shape or color should be brought to the doctor's attention. Report anything of concern to the doctor as soon as possible. Skin cancer is much easier to treat if it is discovered early. With proper support, there is absolutely no reason why a person with albinism cannot or should not lead a normal life. If you are listening to this broadcast and are resident in England, the Royal National Institute of Blind People, RNIB, has more information about living with low vision. You can get support for yourself or a child by contacting them. There is also some advice on education and learning and what support is available from the Education Department. If you are resident in some other country, please speak to your doctor regarding any support available in your country. We will bring you more information from time to time. This program has been brought to you by the Health Broadcasting Service, HBS Radio Channel, UK. Remember to stay abreast of our broadcasts by subscribing to our channel to receive future helpful and beneficial episodes. We will be back again soon. And until then, it's bye for now.
You've been watching the Health Broadcasting Service YouTube channel. Your channel of excellence and distinction. Pioneering specialist radio broadcasting. Giving you the best experience. Subscribe to our channel.